So then when we talk about the muscles of the lower leg, there's 3 different compartments. Do you remember what those are? So yeah, anterior and posterior, and then what else? What's what they said? Lateral. All right. Okay. So on the posterior compartment, you can divide that into superficial and deep. Okay. Typically in any of these muscle compartments, like in the forearm and in the lower leg, the superficial ones tend to they don't cross the joint very far. Like in the forearm, those are the ones that tends to flex and extend the wrist. And the deeper ones tend to go to the fingers. And the similar kind of thing happens in the muscles of the lower leg. The posterior compartment, you have the more superficial ones, and they're the gastroc, and that just goes to the calcaneus right here. Okay? So that's, you're going to have the gastroc and the soleus. And of course, the gastroc crosses how many joints? 2. The knee, because it comes from up here on the femur, and then it goes across into the calcaneus. But the soleus, how many joints does that cross? 1. So that's going to be this other one right here. Okay.
Is the soleus also superficial?
It's part of the superficial division of the posterior compartment. Okay. Yeah. Because they attach to the same place, it's just a little bit deeper than the gastroc. And then on your lower leg, you can tell the difference between the gastroc. It's going to be this bulkier muscle right here, and then the soleus is going to be this other one deeper underneath here. And see, so that right there is going to be the soleus, and then this is going to be the gastroc here. And then they insert together into the Achilles tendon. And then here's the popliteus muscle up here. The one that I was talking about where you have that screw-home mechanism of the knee. As you can see, as that screw-home mechanism, the tibia is going to externally rotate. And then if this muscle pulls this way, what's it going to do to the tibia? Because we're looking at the backside here, so it's going to do this, which would be internal rotation of the tibia. So it unlocks that screw-home mechanism. But then on the posterior compartment, the deep ones are going to be these muscles here that come on this side. Not these. These are going to be the lateral compartment. So these are the deep muscles here on this side. So this is the mnemonic for this is the Tom, Dick, and Harry, or the full name of it is Tom, Dick, Van Harry, because the VAN stands for vein, artery, and nerve. Okay? So flexor digitorum. Actually, if you want to follow the order, Tom stands for tibialis posterior, because that's the way that the order of the tendons are. If you look here at the tarsal tunnel. Okay? We'll talk about the tarsal tunnel in a minute, but that's basically what this is. The tunnel that they go through is called the tarsal tunnel. Just like in the hand, you have the carpal tunnel right here. You have the tarsal tunnel in the foot. And that's posterior to the medial malleolus. So it's tibialis posterior, extensor, or flexor digitorum longus, and flexor hallucis longus. So Tom is for the tibialis posterior, Dick is for the flexor digitorum longus, and then Harry is for the flexor hallucis longus. So that's the way those tendons sit there in that order as you go from anterior to posterior. So take it to show that later on. Because yeah, when we talk about nerve tissue, we'll talk about the tarsal tunnel a little bit more. So that was the 2 different compartments on the posterior compartment of the leg, 2 different layers. You have the posterior superficial part was the gastroc and the soleus, and then the deep part is tibialis posterior, flexor digitorum longus, flexor hallucis longus. And then you also have the vein, artery, and nerve go through there too. Then you have the lateral compartment, okay? And if you're old school, like when I was in school, we call it peroneus. Peroneus longus and brevis. But now they call it fibularis longus and brevis. And that's on this lateral side here. Okay? And those are going to come back behind the lateral malleolus. Okay. And what they're going to do is going to be plantar flexion and eversion. So they're coming on the lateral side of the foot, and they're going to pull it across this way, and they're also going to plantar flex. And then the anterior compartment, and we've already talked about the tibialis anterior with the shin splints. Okay? So again, in the anterior compartment, you're going to have two different layers. You're going to have a superficial layer and a deeper layer. So in the superficial layer, starting from working from medial to lateral, you have the tibialis anterior right here, and then you have extensor digitorum longus, and then extensor hallucis longus. Okay? So you can see this would be the extensor digitorum longus, and then this would be the extensor hallucis longus. And then the hallucis is the one that sort of comes out a little bit deeper. There's not such a division between the superficial and deep as there is in the posterior compartment. In the anterior compartment, we're really just looking at three muscles. But the tibialis anterior and the extensor digitorum are a little bit more superficial, and the extensor hallucis comes a little bit deeper and then goes to the big toe. As you can see, it sort of pops out here from in between the other two and goes to the big toe. Whereas tibialis posterior only goes to the first metatarsal and the first cuneiform here. Extensor digitorum is going to go to the second and the fifth toes. Extensor hallucis obviously is going to go to the big toe. So then this gets back to the Tom, Dick, Van, Harry. That's the tarsal tunnel. So just like we had the carpal tunnel in the hand, you have a tarsal tunnel in the ankle foot. And it's just going to be coming right back behind this medial malleolus right here. Okay? And that's going to be the tibial artery and vein. And then also, when you go farther down into the foot, you have anterior and posterior tibial nerve, and then plantar nerves. So it's a tibial nerve here, and then once it goes into the foot, it becomes a plantar nerve. And that's typically called the posterior tibial nerve, because then you have another anterior tibial nerve over here. And when you do special tests, one of the things you do for nerves is there's three different things you do when you're testing nerves. You either stretch the nerve, like in the low back you'll do what's called the straight leg raise test, where you're just tractioning that nerve going down the back of the leg. Or you narrow an opening that the nerve goes through. Okay? So like if you're doing cervical compression tests like this, or for carpal tunnel you do like this Phelan's test. Or you do what's a lot of times called a Tinel's test, where you're tapping on a nerve. So in this case, in carpal tunnel, you tap on the median nerve here, and then you can tap here on the tibial nerve here, and then also tap here. Because this nerve's going down here, this one's going down this way. So you can have tarsal tunnel syndrome in the ankle foot, just like you can have carpal tunnel syndrome in the hand and wrist. All right, so we talked about nerve tissue, which was the bones, and then ligaments, and the joints in the ankle foot, and then we talked about the ligaments, which is the other part of the nerve tissue. Not so much going on with bursa in the feet. Okay? And then we talked about the different contractile tissues. And then obviously we talked about things like we talked about shin splints. Okay? So then we talked about the nerve tissue. In this case, basically you're dealing with the tarsal tunnel, where you have the posterior tibial nerve back here. And then that leaves us with vascular tissue. Okay?